What to expect on the day of brain surgery.
Typically, the patient will be seen by anaesthetist a day or two before surgery to make sure that the cardiorespiratory function is good and the general health of a patient is good. On the day of surgery, a lot of protocols are put into place to ensure that surgery proceeds safely. A lot of check and balance protocols come into place. The patient will be wheeled into surgery, into the operating theatre. The anaesthetist will probably run some medications, put the patient under. And once the patient is under, then it's when I start my work. A lot of specialized instruments are used during surgery. The navigation system comes in, the operating microscope comes in, a lot of very specialized tools are used. All these tools are prepared way much in advance by the surgical team. Average operating time for a brain tumor can be anywhere between 2 to 6 hours, depending on the complexity of the tumor. Surgery proceeds in a very safe, controlled environment. Once surgery is completed, the patient is woken up. The anaesthetist will gradually wake up the patient after surgery. This whole waking up process can take anywhere between 15 minutes to 45 minutes, depending on the complexity of the case, depending on the type of anesthesia used. Once the patient has woken up from surgery in the OR, he is then transferred to the ICU to be monitored for a day or maximum up to 2 days. This is where the most critical monitoring occurs. We monitor the patient's brain pressure, we monitor the patient's consciousness, monitor the patient's heart rate, breathing pattern. Drugs are instituted constantly during the first 24 to 48 hours. Rehabilitation starts almost immediately.